Today on Focus St. Louis's Leadership Podcast, I am joined by Dr. Alex Garza, a leader whose career spans medicine, military service, public health, and civic engagement, and just all around great parenting.
Yeah, thanks.
Yes, and just a quick bio highlight, his role as Chief Community Health Officer at SSM is what he currently does. Former leader of COVID-19 Task Force. I want to say that probably doesn't go away because when it comes to, it's not that when we think of what the object visual is for COVID, we see your photo next to it, but in a very good way.
Okay, good.
Yes, and also Army veteran. Today we're going to talk about leadership in crisis, the future of health and civic life, and maybe find out what Dr. Garza listens to on his morning drive.
Okay.
Okay. Yeah. So welcome to our show.
Well, thank you. It's a pleasure to be here. Thanks for inviting me.
Oh, absolutely. The first time I heard you give a presentation to our Leadership St. Louis program participants, I was just awestruck, fascinated. The class wanted you to talk more because they said, wow, how cool that you're able, for lack of a better word of describing it, to do sort of an autopsy of what happened leading up to the pandemic that resulted in what we today know as the COVID-19 Task Force. But let's dive in a little deeper and start from the beginning.
Yeah.
In the beginning was the word. No, not really. But what experiences would you say have shaped your approach to leadership?
Yeah, I'd say it's a couple of different things. So, one is early on in my career, I did clinical medicine, so emergency medicine. But even before then, I was a paramedic in the streets of Kansas City.
Oh, wow.
And I worked for a wonderful group of individuals in Kansas City. And I learned a lot about organizational culture and commitment to excellence and things like that in working with that. And I often credit that with starting me off on the right foot in medicine. And then I think it sort of built from there. And I told my students when I was at St. Louis University, you never go directly from A to Z. There's always midpoints along the way. And I think things build on top of each other. So started as a paramedic. I learned a lot during my years as a clinical professor in emergency medicine, teaching, doing research, and being surrounded by really just wonderful people. The military, of course, is all about leadership.
Right.
And so you learn a significant amount about leadership, both in peacetime and in wartime. And it's a completely different atmosphere when you're deployed into a theater of war. And so you learn a lot there as well. My time in the federal government learned quite a bit about leadership at that very high level in the executive branch. And then just various other things. I mean, I think you just pick up these little tidbits about leadership, and you see people that you emulate, and you also see behaviors that you don't want to emulate, and you make sure you put that on the list as well.
Absolutely.
And so I think it's just a combination of things, but all from various different points in my life.
So you mentioned Kansas City, for example.
Yeah.
Would you say that there was a defining moment for you in Kansas City that just made you think that, you know what, I am one day going to marry medicine with public health and civic engagement?
Yeah. So there's a couple of things. So being a paramedic, I always tell people was really, I think, one of the foundations of my interest in public health. And the reason for that is when you operate in medicine, it's typically in the hospital or in the clinic. So it's a very sort of, as sterile as it can get environment. But it's people that are coming to you, that are in your environment instead of you being in theirs, and understanding what their challenges are and what the issues are, what the neighborhoods look like, what their house looks like.
Sure.
But being a paramedic, you're delivering care in the streets,
mm-hmm.
and you're going to people's homes, and you're understanding what's going on in the community. And so I really think that influenced me quite a bit in trying to understand that there's more to health than just the delivery of health care. It's all of these different things. And then a number of other things in Kansas City. So I frequently tell this story about when I graduated from my residency program, wanted to do research. My goal at that time was just to be an academic emergency physician and someday be a chairman. And so I decided to get my master's degree in public health. And so I came here to St. Louis University to do that. And I often tell people I think that's one of the most valuable experiences I've had from education.
How so?
Because you learn much more about the broad aspects of what influences health. So when you're in medical school, it's typically very clinically focused. It's single patient, single disease, treatments, things like that. Move on. You get very little education in epidemiology or community health or any of these other very broad issues that significantly impact both the individual and the community at a much larger scale than just the clinical aspects. And so taking what I learned from SLU, I would often try and incorporate this into my work in emergency medicine. One of the things that we would do is at shift change, we often run through the board. So we talk about patients that are in the emergency department, what they're there for, what their treatment plan is, various different things. And so I would speak with the residents and say, okay, now tell me which one of these is not a public health problem. And I worked in Truman Medical Center, which is a county hospital. And inevitably, you could really trace the clinical issue back to a public health issue. So, for instance, somebody presenting in diabetic ketoacidosis, which is what happens when you're not taking your insulin and you're diabetic, and you eventually develop acid in your blood and you become comatose and have all these problems. Well, the issue isn't that they want to be in DKA, as we call it. It's they can't afford their insulin. Or if you think about urban violence, people don't come to the trauma center. We were a level 1 trauma center. We were the gun and knife club because they want to be shot. It's because of all of the urban violence that was occurring. And there's reasons for that. And so I would try and impart upon the residents, there's reasons why people are in the emergency department, and it's not just clinical. The vast majority of it are these other reasons that brought them to us, why they're laying here in front of us.
Right.
Unless we move upstream to address those issues, it's all we're going to be doing is seeing those same patients over and over again.
Wow, what a profound lesson. You had mentioned in the prior question that I asked you that there are differences in leadership.
Yeah.
And you mentioned government versus maybe even healthcare. Can you compare and contrast what you would say are some of those lessons in leadership along the ways in different environments or sectors that you've been in?
Sure. So I'll just parlay off a couple of people that I think were excellent leaders in my time. One of them was one of my partners at the health department in Kansas City, who was also, by the way, a military person. He was a Navy person. I didn't hold that against him. But and what made him, I think, a good leader is that he was very logical, but also very practical, and always listened to people, but also wanted to understand the evidence on any decisions that we were making at the health department, but treated people as equals. There was no, difference in hierarchy, even though military is very hierarchical. But in our sort of civilian setting, there was none of that, even though he was my senior. We treated each other as colleagues. He treated everybody as a colleague and really tried to get the best out of them. And I think that's a true mark of a good leader. Now, of course, that's in the civilian environment. In the military environment, it's a little bit different. You get sort of this wide variety of different types of leaders in the military, both in garrison, so in peacetime,
Right.
and then also when you're deployed.
What's the difference?
Yeah, so and I think there's a difference as well in what is the period that you're deployed in. So I was in the initial push into Iraq. So, once we kicked off what we called going over the berm, which was, we're entering Iraq now and it's game on. It's a totally different environment, totally different, because we have rules of engagement, but it's you're not sure what's going to happen.
Right.
You're not sure what what the enemy troops are going to do. You're not sure what your reaction is going to be, and so In some ways, there was almost no rules. It was, we're going to make this up as we go along, which
Wow.
sounds a little bit scary.
Yeah.
I mean,
But you've trained for that, right?
Yeah, but you've trained for it, but you can never fully train for it. You can never understand what's going to be happening in the environment. And so bringing that back to leadership, I served with my executive officer. He was also my roommate, Major Bill Burke, who is, I think, a phenomenal leader. And the reason why is again, some of those very same attributes that my colleague at the health department had. Would listen to everybody, but he was very direct and succinct about what needed to happen and how we needed to do it, but wasn't rude about it. It was, this is what we're up against. Right. This is what we need to do. Let's get it done. You know, and the true mark of if an officer is doing a good job is if the enlisted and the NCOs believe in you. So the NCOs, the non-commissioned officers, are the backbone of the Army. They're the ones that get it done. And if they trust you, you know that you're doing a good job in leadership. And so really enjoyed working with Major Burke. We had a couple of leaders that I didn't care for too much.
Let's talk about that, because you mentioned that there are leaders that we learn lessons from, and then there are those that you're like, you know what? Yeah. If I were doing that, I would sidestep that leadership strategy.
Right. So I was in a civil affairs battalion, which is the hearts and minds strategy for the Army. I led a public health team, 5 soldiers. Our job was to rebuild healthcare in the country. That's a very different mindset than an infantry officer. An infantry officer is, and I'm not painting this with broad brush, but they're trained to fight, right? Yeah. Our job is to help the population rebuild. And so you have to have that sort of mindset that I'm here to help these people to try and get back on their feet. I mean, the ultimate goal is so that they're not causing problems for the combatant commander, but really you have to be invested in the community as well. Like, we're here to help you. So then you don't turn on the Americans and then start, then you break out into different types of war. So having that mindset, though, that you're there to help instead of just you're there to occupy or to, dominate the population is very different. So saw officers that were not bought into the mission. Like, really? We're there to help you. These people are not our enemy.
So so did they go rogue, or they were?
No, it was just in the approach
Gotcha.
that you take.
Okay.
So my approach was, you're going to be my friend until you tell me otherwise.
Right.
Right. And at some point, you have to trust that what they're telling you, or the direction that you want to go, is the right thing to do. Otherwise, you just spend your time being paranoid the whole time. You never get anything done.
Right.
And so some, leaders were not bought into that mission, and it caused problems because then they would do things that would be counterproductive. So, it's as simple as things as. So I'll give you an example. There was looting going on after the war, right? So people are stealing copper, all of these other sorts of things. But you have to understand, like, these are people that have been dirt poor, that have been under extreme oppression for their entire lives. And so, there's going to be a little bit of looting going on, but am I going to spend the most of my time worrying about that? No. I'm going to try and we're going to control it. We're going to do some law enforcement, all those other things. But the last thing you want to do is try and persecute people for doing things like that, which is what one of these officers tried to do. To a very extreme example, such as pulling them over on the side of the road, popping all their tires with their knife, and then, blowing up their truck with a tank round. So that doesn't help anybody. In fact, all it does is it turns the people against you.
Right.
Instead of just saying, hey, just leave your stuff here, go on your way. But if you take that extra step to demonstrate that you can dominate over them, that's just going to turn them against you. Now they're going to come up with ways to get back at you. They're trying to provide for their families. They may not be doing it in the best way.
Right.
But at the end of the day, that's what they're trying to do.
Right. Wow. What a tough spot. Because, when you You've heard a lot of things, or we've all read a lot of things in terms of when military or the Army go into a country. How do you build trust
Yeah.
with those that are there, that are living, the life,
Yeah.
however oppressive it is?
Yes.
To be able to get the work done.
Yeah. And so I guess the leadership lesson there is you have to be able to balance a lot of different things when you're in a combat environment. Not all of them are based around conflict. Some of it has to be around mutual partnership and trying to understand what the other person is thinking, how they're going about their lives. The Arabic culture, the Muslim religion, very different than what Western soldiers are used to.
Right.
So you have to appreciate how that drives the way that they live, how they make decisions, all these other things that you're going to be confronted with. If you really want to come up with the best solution strategically, that's going to help you, rebuild the country so that you can extricate yourself from it and leave it stable.
Right.
That's the goal.
Yeah. Listening is important.
Absolutely.
And cultural competency is also very important.
Absolutely.
I think I would be remiss if we didn't talk about the St. Louis Pandemic Task Force during the COVID. What lessons in resilience would you say stand out most to you, or even in decision making?
Oh, boy. Well, in decision making, it's sort of along the same lines as almost, and I've written about this. I felt the same way as I did when I was deploying to war. Like, what's going on? What are we going to do? We're not sure what's going to happen. So just like going over the berm,
right?
It's we're not sure where this is going to take us, and we have to be open-minded about the direction that this is going to go. We're not sure how this is all going to play out. To my benefit, I had a lot of great partners in the pandemic. Dr. Clay Dunnigan over at BJC, Dr. Keith Starkey at Mercy, and numerous other people that collectively had a lot of cool, logical heads that could decipher a lot of information and come up with some best plans going forward. So I was extremely fortunate to be surrounded by really good people. As far as the resilience goes, it's challenging to think about that now in hindsight. And I think I mentioned this with the focus group. Looking back, you can always sort of pinpoint some issues that you're like, yeah, we should have done that a little bit differently. But you make decisions in real time, and so it's difficult to go back and say we should have done that differently because you're operating on the information that you have at the time.
That's correct. I
do think, though, that in general, the public was quite resilient in the face of a pandemic. By and large, people understood the challenges that were in front of us, the issues that we needed to address, and play their part, and did so. I think, even though it impacted their lives quite dramatically, but I think by and large they understood that this is a once in a lifetime event.
I like how you phrased that, once in a lifetime.
Absolutely.
May it never happen again.
Yes.
Indeed.
Yeah.
So what emerging challenges are in public health today that you would say it keeps you up at night?
Oh, yeah. Well, so there's any of a number of things. So, of course, there's always going to be more infectious disease floating around out there. There's avian influenza that's circulating right now, and it always has the potential to make a jump to the human species. Right now it's circulating amongst fowl and birds and things like that. And so that's always a concern. We are doing better on the opioid epidemic, but there's still significant challenge with that. If you look at some of the leading causes of death in the United States, you have to think about it by age groups too. So, but a couple of the leading issues in mortality for young people is opioid abuse and gun violence. And so I think you have to pay attention to those. Globally, infectious disease is still a big issue. And then, so those are more the clinical sides. When you think about the more administrative piece or sort of the policy piece, I think we're in for some challenging times as well. With
How so?
with all of the issues with the Medicaid cutbacks,
Right, yeah.
it's going to prove difficult for a lot of the working poor. So I think we're going to see a lot of people being dropped off the Medicaid rolls, which it trickles down to the healthcare system, the healthcare delivery system, but also to people's lives.
Right.
I mean, if you can't afford access to healthcare, it's going to impact your life.
Yeah.
So you have
solutions? Are there solutions on the horizon?
not that I've seen.
Okay. Okay.
You know, it's challenging because if you think about the big levers that really drive healthcare are mostly policy decisions. It's we can come up with all these advancements in clinical care, medical care, AI, all of those different things, but if you can't afford basic access to healthcare, it impacts the population.
Seriously problematic.
Yes. No, absolutely.
Wow.
Yeah.
Well, so policy change or just advocacy?
Advocacy, has become even more important.
Yeah.
I mean, it's always been important, but it's even more important now.
Now more so than ever.
Yeah.
So what gives you hope about the future in terms of public health and also in terms of the future of St. Louis?
Yeah, I do think that people are more and more recognizing that it's not just the delivery of healthcare that impacts the health of the individual and the community, that there's bigger issues at play here. So whether it's education or housing or transportation or food, those are the big rocks that really need to be moved in order to improve health. And I think people are understanding that more and more now.
Right.
So I think that's a good thing. I think previously, especially when I was in school, it was more just delivery of healthcare. But I think we understand that there's other issues at play that really drive health. And so focusing on those things, I think most people agree are important. For St. Louis as well, I think we have a great future in front of us. I really do. St. Louis is, I think, really this unknown gem where we have amazing educational institutions.
Yes, we do.
We have amazing people. We have amazing companies. And I think we really do have a spirit of people want to do better. Like they really collectively want the region to succeed. There's a lot of pride in St. Louis.
Oh, absolutely.
And I think people really want to see it move forward.
So since we're shooting this in downtown St. Louis, if you had a billboard in downtown St. Louis with one message for the city, what would it say? What would it be on it? I've heard some nuggets just based on what you've talked about today, but I'm curious.
Wait, how many words do I get?
Well, remember it's a
billboard.
Don't make it a paragraph though.
Yeah. No, so the first thing that came to my mind was "Let's go."
Okay.
So
I like that.
Hey, let's go.
Let's go.
know?
Okay. You could get a T-shirt.
Yeah.
Kind of like "Just Do It." Remember that "Just Do It"? Nike's
Exactly.
back in the day.
Yeah.
So you have a very heavy job. If you could trade your job for one day.
Wow.
What would you, or even for 1 week,
Yeah.
what would it be? What's that dream secondary job?
Oh, yeah. So I think I get torn though. So, part of what gives me a little bit of peace is just doing outdoor work or being outside. And so I think I told you I just returned from a small vacation with my family. And so we were out in Oregon, out in Bend, Oregon. And it was a beautiful surrounding.
Yes, it is beautiful. Yes.
And so you're out on this river and you're just fishing and it's like, I could do this, So part of me is like, gosh, being a fly fisherman doesn't sound too bad.
I want to say all you have to do is to put it on TikTok and next thing you know, yes, it's the biggest next career for a lot of people to de-stress. Yes.
Yeah. And so that's one thing is like that could be the life. The other thing is, and I was reading something about this morning in the Washington Post about, having a psychologically fulfilling life. And it was based on like, you have to have things that challenge you, even if they don't work out the way that you want them to. And so, part of you is like, well, what is a big thing where you could influence, the country or the community or things like that. And I don't know what that is, but you think about things like that.
Mm-hmm.
Like I love my job now. I absolutely love my job. But then you get to thinking, like, what other things could you be doing in order to influence those really big rocks that we were talking about that you could move to really impact the community? Yeah, and I don't know what that looks like, but
psychologically happy, or content, or something like that.
Right,
I'm going to have
psychologically fulfilling life.
Yeah. So I mentioned at the top of the hour that it'd be interesting to learn what book are you reading now.
Yeah,
and what music sort of de-stresses you. So let's dive in to that.
So this is going to sound really boring, but it's actually a pretty cool book. So I got this book called Good Prose by Tracy Kidder. So Tracy Kidder is a Nobel-winning author who does nonfiction.
Right.
Wrote Mountains Beyond Mountains and a couple of other books. Because I was interested in writing some essays about some of the lessons learned from my different experiences. And so I thought it would be great to learn from the best. And, it's more than just, hey, you should really write in the third person or first person. It's really a descriptive book about how he and his editor went through the process of understanding how to write good prose. So it was really, it's a fascinating book. About halfway through it now.
Okay, so we should expect your book.
Yeah.
Let's do it.
Let's go.
Let's go.
Yeah.
I like it. And music?
Music. Oh, let's see. What have I recently downloaded? So I go anywhere. So I'm kind of a weird music guy. So this morning I listened to anything from the Chicks, so it used to be called the Dixie Chicks.
Yes.
To Mozart's Requiem. Ooh. And so it really depends
on
a
range.
I know. So it depends on what I'm doing. If I really need, it's like I was concentrating on some work on the computer today, and I usually have my earbuds in because I don't like to be distracted. And if it's something I have to concentrate hard on, then I typically put on classical music because if I have other music on that has words, then I try and sing along with it, and then I get distracted.
Are you a good singer, though?
No, I'm terrible.
Oh, okay.
Yeah.
All right. Okay. Well, this final question for you is, you're a physician, you're a leader, and I want to say you're a soldier. What's one lesson from each of those roles that still guides you today?
Yeah. So I think that the common thread that sort of weaves through there is service and compassion. I think you have to have compassion as a physician to be a good physician. I just do. And I think in certain instances, you have to have compassion as a soldier as well in order to do your job. It's compassion for your soldiers that you're leading, as well as if you're involved in a conflict, you have to have that compassion, or at least a capacity to have compassion to understand. There's a great quote from Louis Pasteur who said, when somebody suffers, you don't ask them what is their religion or what country you come from, you suffer, and that's enough. And I think that sort of encapsulates, service as a physician, as a soldier, as a leader, things like that. Yeah,
and I forgot to add, how about as a parent? Because we were talking about your kids leaving the nest, so to speak.
Yeah. So a parent is also, it's this multifaceted role. So you want your kids to grow up, happy, but you also want them to understand responsibility and be compassionate and empathetic folks. And so you have to show them, you have to model good behavior. You have to set boundaries for them, at least when they're young.
Right, I'm learning that right now. Yes.
But you also have to be comfortable with letting them figure it out and letting them fail. I think the worst things that you can do is not let them fail. Because when they get older in life and then they do fail, they don't know how to recover from it.
That's true.
And so it's hard as a parent. But I do think that is one thing that provides them insight and the ability to cope and to be able to manage when they get older as well.
Well said. I am writing that down. It looks like that's all the time that we have today with Dr. Garza. I want to thank you for your service for our region in all spheres and for sharing your story with us today. I have to say that I've been looking for this interview because I've hit a pause for a minute on the Focus podcast, and it is a delight. I'm going to read that book as well. And we're going to look for your book. So thank you again for joining us.
Well, thanks for having me. I really appreciate it.
You're welcome.